Hi, I'm Bill Patten, Interim CEO here at Rehoboth McKinley Christian Healthcare Services. I want to give you a report today from the board meeting that was held yesterday on July the 24th. This was a regular meeting of the board. It was called to order by our new board chairperson, Mary Ann Eustick. We started the meeting just after 1 o'clock after dispensing with review of the agenda and review of minutes. We had a presentation from Mariah Rangel. Mariah is the director of our Surgical Services Department. We've started a new informational process for the board where every month we're bringing in a department and they're providing the board with a summary of the services that they provide, summary of equipment, personnel, so that the board can be more in touch with the department level operations of the hospital. Last month we did imaging, this month surgery, next month's going to be laboratory. So the board really appreciated the information that Mariah presented. The board then reviewed minutes from a number of board or medical staff committees. They reviewed and accepted the report from the quality committee. They reviewed and accepted the report from the finance committee, and I'll talk a little bit more about finances in just a minute. And then they had two reports from the medical staff, one from the credentials committee and one from the executive committee, medical executive committee. And as part of that report, the board approved recommendations related to credentials and privileging for new physicians or for renewing privileges for existing physicians. Rebecca Martell, our Chief Human Resources Officer, presented a report to the board regarding a number of human resource metrics. For the most part, all of those are very positive. We've been quite successful in recruiting new employees. One of the programs that we have, the referral program for our employees, we've hired 14 new employees because of referrals from coworkers. So very good progress there. Our vacancy rates are well below national averages. National average would be around 20%. We are at 13%. And the number of travelers that we have is reduced significantly. So right now we have about 13 travelers. That helps us as far as continuity of the services that we provide, but it also helps us as far as the cost of those services. We would much rather have permanent employees that are based here in Gallup. Chris Dover, our Chief Financial Officer, gave a report related to our finances. We are now caught up as far as our monthly financial statements. Chris presented financials from April and May, so that's on track for where we need to be. And quick summary as far as our financial performance. Through the first 5 months of the year, we have lost about $1.8 million, and I know that's a lot of money. But if you compare it to our performance last year, at this same point in time, we had already lost $7.4 million. So a huge improvement. Month to month, we're seeing much better numbers than we had been last year. April was a very bad month for us. We lost almost $1.5 million in April alone. The other 4 months have either been close to break even or small losses. May, for example, we lost $275,000. That's 2% of our budget. And so we've identified that there are two different revenue opportunities. We believe that our volumes are adequate to produce break-even financials, but our processes for capturing our revenue, getting credit for all of the work that we do, and then all of the supplies, the billable supplies that we use, both of those processes we don't think are as efficient as they need to be. So just this morning we assigned work groups, one to work on charge capture process and the other to work on supply charge capture process. And we're going to have a report for the board at the next meeting. So while we're not quite at break even yet, huge progress from where we were a year ago. And now that we're able to have our monthly financials, we're going to be much better able to actually make changes. We held a series of 4 all-staff meetings on Tuesday of this week, and this was one of the topics that I emphasized for the employees, the balance between the revenue side of the equation and the expense side of the equation. And I highlighted to the employees that if the revenue isn't adequate, then we need to go after the expense side. And our number one expense is people. And I encourage them not to think, oh, Bill's talking about doing any sort of a layoff. I'm not. I just wanted the employees to understand their personal responsibility in making sure that we get credit for all the work that we do and that we get credit for all of the supplies that we use in providing good patient care. So we have two teams that are working on that. I'll be able to report in my next video our progress, the areas of opportunity that we've identified and the steps we're taking to try and make improvements there. Jeff Link did a presentation to the board on quality efforts. In the past, we've had two different quality committees. One we thought of as a hospital quality committee, the other one we thought of as a board quality committee. The board has decided to streamline things and combine the two committees. So Jeff reported on the committee meeting that was held earlier this month, and the board was very appreciative, felt like they were getting good detail as far as the operations of our quality processes. And then I gave my report to the board. I started with comments related to cardiology expansion of services. We've been working on this for several months. We currently have cardiology services 1 day a week. We would really like to have that at least 3 days a week. We had a proposal we were ready to present to the board, but early yesterday morning before the board meeting, I got a call from the group who withdrew their offer. The cardiologists they were planning to recruit had fallen through, so they weren't in a position to offer the expanded services that we need. So we're going to go back to the drawing board. It's important that we have expanded cardiology services that affects our ER, our inpatient, and our surgical programs. So that's something we're going to be working on. I highlighted to the board that we've been successful in recruiting a new podiatrist, Dr. Carlos Rodriguez. Dr. Rodriguez will be starting with us early in September, taking Dr. Spiva's place. So it's unfortunate that we don't have coverage for a few months, but it's fortunate that it's only a few months. Recruiting these days can be very time consuming. So we're happy to have Dr. Rodriguez join us. Made a proposal to the board that we should purchase new scope equipment for our operating rooms, for colonoscopes and EGDs. The proposal was for two different systems at $165,000 per system. The board approved those pending receipt of the money. So as I mentioned, our cash based on our profit and loss is lower than where we would want it to be, but we are expecting a number of special payments. One of them from a cost report for Medicare, that when we get that, we'll have enough money outside of our normal day-to-day cash to be able to make these purchases. So I think I've mentioned in previous reports, we're going to be buying new anesthesia machines, new monitors for the OR, as well as new equipment for our sleep lab. And then at the last meeting, the board had approved purchase of new software for our electronic medical record system so that we can more efficiently bill as a new critical access hospital and for the newly developed swing bed program. We talked about the state money. I gave the board an update on the different pots of money that are available to us because of the work that the state legislature did this past session. So the first one is $15 million. At their meeting on Tuesday morning, the county commission voted to approve the transfer of the $15 million from the state to Rehoboth. The plan is that we will receive $3 million a month for 5 months, with the intent being that we use that money to repay debt. Quick summary as far as where we stand on debt. In October, we owed $33.5 million. Through the end of May, we have reduced that to just under $22 million. There's $4 million more from the payroll support program So that will take us down to 18 million. So we've got 15 million that we need to use to get rid of 18 million in debt. That's about a 22% reduction. So I'm working hard with vendors to achieve settlements. I owe you, I'll make up a number, $300,000. Let's settle that for $225,000. If we can achieve settlements of that type, then I'm confident that we're going to be able to retire that $18 million in debt that we have. But there's also another pot of money, Senate Bill 161, that will allow $5.7 million over 2 years. The application that we submitted last week, we asked for $4 million this year and $1.7 million next year. The $4 million will be paid quarterly beginning in October. So that money is not earmarked. So in the event that we're not able to get enough settlements from the 15 million, then we'll be able to use the 4 million from the 5.7. I know that's a lot of numbers to throw around, but I want you to understand that we are optimizing the money that we have been given by the state. We're making sure that we're accounting for every dollar that we use, and we're so grateful for the work that our state legislators, our local officials in the city and the county did. So I just want to say thank you once again for them giving us an opportunity to dig out of this hole. And the numbers that I reported on the operations side, I hope that that gives you confidence that we're taking the steps necessary so we don't dig another hole again. I also discussed with the board the process that they want to use to fill the vacant board seat. As I mentioned last month, Genevieve Robrin has resigned from the board, so we have an open position. The board wants us to use our normal process where we'll be advertising in the local media for a new board seat. So if you're watching this video and you are interested, or you know someone who's interested in serving on the board, look for that information and please submit an application. Also happy to report that at their meeting on Tuesday morning, the County Commission approved a grant for $750,000 to improve the control systems for the heating and air conditioning systems here at the hospital. So another thank you to the county for working in such close partnership with us. The board had an executive session where we talked about a number of confidential issues, including personnel matters and legal matters. It was a good board meeting. One last comment, we updated the board on CEO recruitment. So I plan to have another slate of candidates to present to the board by the August board meeting. As you may recall, we've been through this once already. We had come down to 2 finalists. We made an offer sequentially to one of them and then to the second one. Both of them turned our offers down. So we had to start over. So we already have a half dozen good candidates that we're vetting. We're getting responses to our advertising, both what we're doing and our new consulting advisory services company, Ovation. They're also forwarding names to us. So by the August board meeting, I plan to have a slate of candidates for the board to review, and then they can begin their interview process. I hope you found this information useful. As always, give me a holler if I can provide any other information or answer questions for you. Thank you very much.